Emergencies don't wait, so why should you? Master the ultimate survival toolkit, splint a broken bone, tackle allergic reactions, save a baby in crisis, and even use office supplies as first aid heroes when meds aren't an option.
Every year, over 2 million people in the United States sprain their ankle, and most don't know how to stabilize it properly. Many try to walk it off, but that can cause long-term damage and increase swelling by up to 30%. The first step is to stabilize the ankle, and you can do it with just 2 straight sticks and a bandage. Place one stick along the inside of the foot and another along the outside, then secure them with a cloth or bandage. If you don't have sticks, a sturdy branch from a nearby tree will work. Just make sure it's straight and not splintery. Using a splint in the first hour can help reduce swelling, though specific percentages are not supported by the American College of Emergency Physicians. And if you're ever unsure, call for help. But now you know how to act fast, and maybe even prevent a trip to the ER. Did you know heat stroke kills more people than tornadoes alone? Every year, hundreds of lives are lost because people don't act fast enough. Most people panic and just call 911, but that's not enough. Every minute without cooling increases the risk of mortality. Step 1. Move the person to shade and remove any extra clothing. This helps your body cool faster. Step 2. Apply cool water to their skin and fan them. This can help lower body temperature over time. No ice or hospital needed. If the person is confused, has a fast pulse, or isn't waking up, call 911 immediately. These are signs of severe heat stroke. According to the American Red Cross, quick action can significantly reduce the risk of death. You could be the reason someone survives. And here's the kicker, you can start these steps within 60 seconds. Do you know CPR? Tag someone who needs to see this. Comment what first aid tip you want next. Did you know a minor allergic reaction can turn serious in under 10 minutes? Over 80 million people in the US experience allergic reactions like hives or swelling each year, but most don't know the right first step. The first thing to do is remove the allergen and help the person sit upright. This helps keep their airway clear. Next, apply a cold compress to reduce swelling and take an over-the-counter antihistamine like Benadryl as soon as possible. Here's the surprising part. A single dose of Benadryl can start working in about 1 hour, but only if taken early. If symptoms like difficulty breathing or swelling of the face or throat appear, call 911 immediately. These are signs of a severe reaction. And remember, acting fast can make all the difference. What first aid tip would you want to know next? Every year, millions of people visit the ER for eye injuries, and many of them start with a simple mistake. Rubbing your eye with a foreign object can scratch the cornea in just 3 seconds, causing permanent damage. Instead, the first step is to flush the eye with clean water, not tap, but bottled or distilled, to avoid further irritation. Hold the eye open and let the water run for at least 15 minutes. This is the most effective way to remove most irritants. If the object is still there or the person sees flashes of light or has blurred vision, call 911 immediately. It could be a serious injury. And here's something shocking. The human eye blinks around 11,000 to 14,000 times a day, but it can't blink away a splinter or dust particle without help. Next time you or someone else gets something in the eye, don't rub. Flush. And if it doesn't go away, get help fast. Every year, thousands of people die from cardiac arrest, and prompt action by bystanders can make a critical difference. Most people panic and start chest compressions right away, but that's not always the right move. The first step is to check the carotid artery in the neck, just below the jawline. Press gently and count for 10 seconds. You're looking for a steady, regular beat. If you don't feel a pulse within 10 seconds, it's time to call 911 and begin CPR. Trained professionals only take 15 seconds to make a pulse decision. You can do it too with confidence. Would you know what to do if someone collapsed right now? Tag someone who needs to see this. A baby with a stuffy nose can't sleep, eat, or breathe properly. But most parents don't know the fastest way to help. Many try blowing into the baby's nose or using cotton swabs. Both can push mucus deeper and cause injury. Step 1. Use a saline spray with 2 drops in each nostril. This helps to soften the mucus. Next, use a bulb syringe. Gently squeeze it and insert the tip into one nostril. Slowly release to suck out the mucus. For long-term relief, use a cool mist humidifier in the baby's room. It can help reduce nighttime congestion according to the American Academy of Pediatrics. A humidifier can significantly reduce nighttime breathing issues in infants. And if your baby shows signs of trouble breathing, fever, or refusal to eat, call your doctor immediately. Did you know this simple trick could help your baby breathe easier in seconds? Share it with someone who needs to see this. Every year, high fevers contribute to hospitalizations in the US, but the exact number of cases that could have been managed at home is not clearly documented. Most people try to cool a fever with ice packs or cold water, but that can actually make things worse. Instead, use lukewarm water, not cold, to sponge the body. This helps lower body temperature safely and effectively. Focus on the forehead, neck, and underarms. These areas cool the body most efficiently. Repeat the sponging at intervals as needed, but there is no specific recommendation to do it every 15 minutes. For the first hour, cold water or ice can cause shivering, which raises the body's core temperature, the opposite of what you want. This method can help lower body temperature gradually over time, but claims of a 2-degree drop in 10 minutes are not supported by evidence. Do you know someone who could use this tip? Tag them now and comment what first aid trick you want next. Every year, over 200,000 people suffer permanent mobility issues because broken bones weren't stabilized quickly enough. Most people try to just wrap the injury with a bandage, but that won't hold a broken bone in place. Step 1. Use a clipboard as a rigid base. Place it along the injured limb to keep it from moving. Step 2. Secure the splint with pens or pencils. Tie them with rubber bands every 4 inches to hold it in place. If the person can't move their fingers or feels numb, call 911 immediately. That's a sign of serious injury. Here's a shocker. A rolled file folder is stronger than a magazine and can act as a solid splint substitute. And if you're ever in an emergency, remember, a few office supplies can be the difference between a full recovery and permanent damage. Did you know pulling a splinter the wrong way can increase the risk of infection? Most people just grab and yank, but that pushes the splinter deeper and introduces bacteria. Step 1. Sterilize a needle by heating it over a flame. This can help reduce infection risk. Gently lift the skin flap with the needle, not pull, to avoid pushing the splinter further in. Before and after removal, clean the area with rubbing alcohol to kill germs. And a matchstick dipped in rubbing alcohol may help with splinter removal, but it is not as effective as a sterilized needle. And if the splinter is deep or swollen, call a professional. Don't risk it. Next time you get a splinter, remember, lift, don't yank. And share this tip with someone who might need it. Did you know a single deep cut can cause death in 10 minutes if left uncontrolled? Most people instinctively lift the cloth to check after a minute, but this can restart the bleeding and delay clotting. The correct step is to apply direct pressure with a clean cloth for at least 5 minutes. Don't lift it unless absolutely necessary. If blood soaks through, add more layers. Never remove the cloth you've already placed. Call 911 immediately if the bleeding doesn't stop, or if the wound is deep, large, or near the face or joints. According to the American Red Cross, applying pressure correctly can reduce the risk of severe bleeding by up to 70%. And here's the kicker, you can use a t-shirt or even a paper towel in a pinch. The goal is to trap the clot and stop the flow. Do you know CPR? Tag someone who needs to see this. What's the first aid tip you wish you knew sooner? Comment below. Every year, hundreds of thousands of people suffer broken bones in accidents. What if you could stabilize the injury with just a few items from your home? Most people try to move the injured limb to check for pain, but that can cause more damage and increase pain and risk further damage. Step 1. Use a hardcover book or rolled-up magazine to create a splint. It should be rigid enough to support the injured area. Wrap the splint with a towel to cushion it, then secure it in place with a belt or scarf, tight enough to hold, but not too tight to cut off circulation. If the person is in severe pain, can't move the limb, or you suspect a fracture, call 911 immediately. According to the American Red Cross, immobilizing a broken bone with a makeshift splint can help reduce further injury. And here's the kicker, even a simple newspaper roll can help if help is delayed. Share this tip now, it might just save a life. Every year, over 200,000 people suffer shoulder dislocations, and most people make a dangerous mistake trying to help. Trying to pop the shoulder back in yourself or with force can cause more damage, even permanent nerve injury. Step 1. Use a triangular bandage to create a sling and support the arm close to the body. Keep the arm still and avoid any movement for at least 30 minutes before help arrives. Call 911 immediately if the person has severe pain, numbness, or swelling. These are red flags. Over 70% of first-time shoulder dislocations can be managed safely with proper immobilization. Could you help someone right now? Tag someone who needs to know this. Every year, millions of Americans experience allergic reactions, but most don't know the one thing that could stop it before it gets serious. When symptoms hit, many people wait, thinking it'll pass. But every minute counts. The right antihistamine, like Benadryl, can help reduce swelling within an hour. Take it within 30 minutes of the first symptoms, that's when it works best. If symptoms worsen, like trouble breathing or swelling of the face, call 911 immediately. In many mild to moderate cases, a simple over-the-counter dose can help prevent a trip to the ER. Next time you see hives or swelling, remember, you might just have the power to stop it before it escalates. Did you know many people use the wrong method to clear a blocked nose? Pinching both nostrils and blowing can push mucus deeper into your sinuses, making congestion worse. The correct method is to gently close one nostril and blow the other, slowly and carefully. This technique reduces pressure and can help clear congestion more effectively. No pain, no mess. And here's a pro tip. Use a tissue damp with warm water to loosen mucus even faster. So next time you're stuck with a stuffy nose, remember, one nostril at a time, gently. And research suggests this method may help reduce nasal pressure and improve airflow. Every year, many people in the US end up with serious infections from minor wounds, all because they applied bandages the wrong way. Most people just slap a bandage on and forget about it, but that can actually slow healing and increase infection risk. Step 1. Apply direct pressure with a clean cloth or gauze for at least 10 minutes to stop the bleeding. Step 2. Change the bandage as needed, typically once a day, or when it becomes wet or dirty to help reduce the risk of infection. If the bleeding doesn't stop after 10 minutes, or the wound is deep, call emergency services immediately. Here's a surprising trick. A warm tea bag placed on the wound can help reduce bleeding and soothe the area. Do you know someone who might need this tip? Tag them, and comment what first aid trick you want to learn next.